right around the corner. Many people are likely headed to a more tropical location.
Well, we haven't heard a whole lot about Zika virus in a while. It remains active in several popular spring break destinations like the Caribbean. And here with the latest insights is Dr. Katie Antony, a UW Health maternal fetal medicine specialist.
Good
Welcome
to
back
see
to
you
the
again.
show.
Welcome back.
Thank you.
So, yeah, we haven't heard a whole lot about it, but it's still out there.
It's true. The epidemic is still ongoing throughout almost all of South America and also all of the Caribbean, more or less. And it could resurface in Florida and Texas or anywhere else in the South.
But it's out there right now just because winter weather and so precautions, I guess.
But in the Caribbean and South America.
Right. They don't get winter down there.
Right.
So what are precautions should people take if they're heading down there?
Absolutely. So before you travel, we recommend checking the CDC's website to see if it's on the list where active transmission is ongoing. If you choose to still go there, obviously wear mosquito repellent, use bug safety nets at night, and also wearing, kind of loose-fitting and long-sleeve clothing. Unfortunately, yoga pants are so tight they don't necessarily protect them against mosquitoes. They can bite through tight-fitting clothing. So.
Okay, so for those who are thinking about starting a family, this is a real big one too.
Yes, unfortunately, Zika, the main reason that it's in the news is because it can cause these profound congenital anomalies in developing fetuses and if a pregnant woman gets infected. And so it's recommended that pregnant women not travel to these areas at all. And avoid travel to areas where transmission could recur, such as South Florida. Other than that, after traveling, it's recommended that people delay becoming pregnant. If a man travels, we recommend waiting at least 6 months before he and his partner become pregnant, and if a woman travels, at least 8 weeks.
Because it could stay dormant in you, the virus?
Absolutely, and specifically for men, the virus can actually persist in the semen for, we think, up to 6 months.
Wow. So if you think you travel, you get a mosquito bite, what should you do?
Right. So unfortunately, the majority of Zika infections are asymptomatic, about 80%. Nobody gets symptoms. And people who do have symptoms, there's fevers, they can get red eyes, they can get joint pain, a characteristic rash, but most people don't have any of those, and so they could have the infection and never know that it occurred. And just because there were no active symptoms doesn't mean that there couldn't be profound impacts on the pregnancy. Yeah,
it's a good reminder because, as we say, we haven't talked about it in months, and now people are heading down there.
Yep.
And there is a community talk, Zika and pregnancy, the latest insights. It's this coming Wednesday, March 22nd from 6 to 7:30 p.m. at the UW Health Digestive Health Center on University Avenue or in person via a webinar. Yes. We'll have more information on our website. Doctor, good to see you again.
Thank you so much for having me.
We'll be right back.